Hi everyone, this is me Sania from the channel Dr. SNA. So somebody who is watching our video for the first time, I would like to introduce myself. I'm a final year medical student from Karachi, Pakistan. We made this YouTube channel to actually spread awareness about different diseases and illnesses that are present in our community, not just in Pakistan but in other countries as well. So before I begin, please subscribe to our YouTube channel by the name Dr. SNA, that is Sania and Amir, and also follow us on Instagram, Facebook, and Twitter. So let's start. So the disease I am going to discuss with you all today is tuberculosis, or very commonly called TB. According to WHO, World Health Organization, TB is the second global killer after AIDS. Last year, about 8.6 million of new cases of TB were diagnosed. 1.4 million people died due to tuberculosis. It is estimated that 1/3 of the world's population already has been infected with TB, but they're not producing any signs and symptoms right now, and they're not infecting anybody. But given the correct circumstances, the secondary infection in those individuals can take place, and they are going to produce signs and symptoms sometime in their life, and they are going to infect others they are living close by as well. Now, the countries which are highly prevalent in TB are Africa, India, Philippines, Pakistan, China, Indonesia. Now, the reason TB is highly prevalent in these areas is because many people over there are living in slums and very close quarters. Their working conditions are poor. Their living conditions are also poor. This leads to the increased spread of the disease amongst them. One another factor is because those people living in those countries are not aware of this illness. If somebody close to them is infected by tuberculosis, they do not know how to prevent themselves from getting infected as well. So in this video, I'm going to discuss with you the signs and symptoms of tuberculosis, and what are the factors involved in developing tuberculosis, and as well as how to prevent from getting tuberculosis if somebody close to you is infected. So keep on watching my video. Tuberculosis develops signs and symptoms according to what part it has infected. Very commonly, it infects our lungs and produces symptoms such as coughing with sputum for more than 3 weeks. The sputum could be blood-stained. The patient could also have chest pain and shortness of breath. Tuberculosis can infect our intestines and cause a chronic diarrhea, abdominal pain, and a feeling of mass inside the abdomen. Tuberculosis can also infect our brain and cause tuberculosis meningitis and produce symptoms such as severe headache, high fever, nausea, vomiting, and altered consciousness. Tuberculosis can infect bones and joints, causing restriction and pain with movement of that particular joint or bone involved. Tuberculosis produces some set of systemic symptoms as well, such as mild fever without any cause, night sweats, weight loss in a couple of weeks, loss of appetite, fatigability, and weakness. Now, the reason for telling you signs and symptoms of tuberculosis is that if you are living in a highly endemic region where a lot of people a lot of cases of tuberculosis is common, so it's important to know that if you have these set of symptoms, so go and get yourself checked out. At least get a screening of tuberculosis done, so that even if you have tuberculosis, you can catch it timely and get yourself treated and actually help your family members and your co-workers by not infecting them with this illness. Now I am going to discuss with you few factors which are involved and in making the person more vulnerable to getting tuberculosis. There are two sets of factors such as environmental factor and disease related factors. Now environmental factors are poor and unhygienic living and working conditions, malnutrition, poverty, overcrowding, heavy cigarette smoking, and alcoholism. Disease-related factors are diabetes mellitus, such as low blood sugar, chronic lung disease, and long-term intake of steroids and cytotoxic drugs. Now, it's not necessary the person exposed to these medications and diseases and these environmental factors will develop tuberculosis. But yes, they are more prone to develop tuberculosis. That means that they are at the higher risk of developing tuberculosis. So the people, if you know somebody who is living in such conditions and have these diseases, it's good to let them know about tuberculosis if it's highly endemic in their region, and talk to them about it and aware them about this disease so that they can timely prevent it from happening in themselves and others as well. Lastly, I'm going to discuss with you how to prevent yourself from getting infected with tuberculosis, and if somebody is infected with tuberculosis, how they can limit the spread of this disease. Firstly and most importantly, if somebody is developing the set of symptoms which I've already discussed, then kindly go and get yourself checked out by a doctor. It has been known that people who actually go and make routine and regular checkups with their doctor are lesser prone to developing these such type of illnesses, and even if they do, they are diagnosed early and they are treated likewise. So the guidelines for somebody who is actually infected with tuberculosis are very, very important, and they should be known by the family members and the person as well. Number one, if the person is coughing, sneezing, or putting his hand near his nose or mouth, then the hands need to be washed immediately. Secondly, if the person is using a tissue while coughing, sneezing, laughing, then that tissue needs to be properly discarded and not be left lying around. If the person infected with tuberculosis is present close to you, then it is advisable to wear a mask. If that you do not want to wear a mask, then make that person wear the mask. That person should sleep in a different room. It is advisable that the people who have tuberculosis do not attend their school or their work until advised otherwise by their doctor. Something which is again extremely important, and it's going to be my last point, is that if somebody in your family or somebody close to you and somebody who works with you is infected with tuberculosis, get yourself screened as well. Because again, it's better to catch this illness early on and get a prophylactic treatment than to later find out when your complications have developed. With this, I would like to end my video and say that if you guys thought this video was helpful, then please give us a big thumbs up, like, share and subscribe to our YouTube channel, and follow us on Twitter, Facebook and Instagram, and let us know your feedback in the comment section below. Thank you so much for watching.